Hi, I'm Dr. Julie Steinauer. Let's talk about vision and posture and how they're related. So there's some really cool things that you can tell about an individual by watching the way that they sit and stand and walk. And I want to share that with you today. It gives us some clues about what's going on with their vision. So for instance, let's say that an individual that you're talking to tends to lean over and is slumpied or slouch shouldered and tends to lean forward a lot. That individual is most likely going to be nearsighted. That's kind of a postural tendency of someone who's nearsighted. Always trying to lean in and make sure that they see things more clear and distinct. They tend to have rolled in shoulders or slumpy, slouchy shoulders. And what about the person who's actually farsighted or has, so nearsighted is myopia, farsighted is hyperopia? What about that person? What can you tell from them? Well, you actually can tell from them. They tend to sit back and up. Their posture is usually shoulders back, a little bit more chest kind of out. And they are typically a little bit more rigid with their posture. You'll see a bit of a better posture with the hyperope than you will with the myope. Now, what about the way that they walk or the way that they stand? It's the same thing. You can watch in walking and in standing as well as sitting. What's happening with the shoulders will tell you a lot. Now, by the way, at this point in the video, have you been able to tell what I am? So other things that you can tell by an individual's posture, what's going on with their vision, is you can see whether or not they may have a misalignment of the eyes towards like laterally or vertically. Vertically, you're going to notice that person tilting their head. Laterally, they may tend to kind of move towards one side a little bit more. They may lean to one side. They may look at you out of the corner of their eye a little bit more. There are actually strong links within the retina to postural fibers in the body, which is crazy. So there are links to muscular control associated with vision. So it's kind of this interesting feedback mechanism that occurs. And based on what's going on with vision, it will kind of determine a person's posture. Now, what if they have an eye turn in or out? Well, you can actually tell by looking at their feet, maybe even their hips. So their hips may be kind of like, they might be off to one side if they have a vertical problem. They might be thrust forward if they have a vertical or a lateral problem with their feet. They may be pointed in, kind of like a pigeon, with their toes pointed in if they have an eye turn in. And they might walk like a duck with their feet out if they have an eye turn out. Exotropia is out. Esotropia is the eye turn in. So there's lots of things that you can actually tell from posture. I would encourage you to kind of look at yourself, look at your kids, look at people as you see this and see if you can kind of figure it out. It's actually kind of, fun, interesting, and definitely enlightening to see. And if we're looking at how someone's standing, we also want to look at like the hip positioning, the feet positioning. Is one foot turned in versus both are turned in? All of this is going to tell us something about vision. Now, I hope you learned something from this video, and be looking forward. We've got a blog or newsletter and information that's going to be going out to our subscribers. If you've not subscribed to our email, you definitely need to do that. There's probably going to be some links down in here after this video to do that. And if you like this video and you like this information, we would love it. Like and subscribe to our YouTube channel so that you can get more awesome updates and cool videos about the things that we talk about. Thank you.